So this patient has a slightly wide tip. See, lateral crura are domed, rounded, and our goal is not necessarily narrow, but reorient it to flatten it and evert it. So you just want to do either a cephalic trim, or we can use sutures, or both. This patient has a very minimal dorsal hump, likely will not open the roof when we reduce it, but she has a nice super tip break with adherence here. So we want to preserve Petange's ligament so you don't have any dead space here. So here's our marginal incision right at the caudal edge of the lower lateral cartilage. Move our hook once, evert, and we follow along. Now we're going to snip and find our lower lateral cartilage. Retract this down, and there's our cartilage already. So now our cartilage is separated, and we can work on it without doing a full delivery. Here's our complete lateral cruce. So we push, that everts it, presents our marginal incision right at the lower lateral cartilage, lateral cruce. Move the hook once, and then just keep moving my middle finger to present the medial cruce. I'm going to start our dissection of the lateral cruce. Insert a single hook, pull straight down, and we're going to dissect. Okay, good. So we've got one lateral cruce. So we've got our two domes delivered. We still have it attached at Petange's ligament. Get that nice super tip break. We can do our cephalic trim or sutures or both without needing to fully deliver the cartilage or separate it. So I'm going to first do a U-stitch, which is like a cephalic dome suture. To narrow the dome cephalically and gives you some eversion. And you can see how this has everted my lateral cruce. Here it's more vertical. Here it's everted. So the position of the lateral cruce is more in line with the dorsum. So again, do a U-stitch. Your suture exits more cephalically. Instead of going across the whole dome, come a little more lateral, and to narrow it, this is described by Milos Kovacevic. And then we'll determine, do you even need to do cephalic trim? Likely not, by flattening, everting, reorienting that lateral cruce. You see how now you've got this. This is the only roundness here on this side, and this is nicely flattened, everted. Cephalic trim wasn't necessary in her, preserving the whole lateral cruce and the scroll ligament. So my U-stitch on the side, about 5 millimeters from the dome. Followed by my single dome suture, or some people call it transdomal suture. Again, we want to flatten and evert that lateral cruce. And she has some twisting of the medial cruce, which will take care of with a columella strut. Good. So you see how the lateral cruce flattened and everted? So again, Again, the orientation is it's flat, everted and flattened lateral cruce. That will make our tip less round, but not compromise any of the strength. So we delivered our domes into one nostril, making a little pocket for our columella strut. Now we're going to insert our columella strut. And we're going to suture our domes. So we're doing a figure-of-8 suture to unify the domes cephalically. Then we'll fix them caudally and also fix our columella strut in place. So our inferior domes are just less than 8 millimeters apart. I'm going to take those domes, tuck them back in. And here's our nice narrow tip. So we have straight dorsum, just slight hump reduction, super tip break, Petange's ligament intact. We've maintained tip projection, actually increased by about 1 millimeter. And from the front, you can see we've narrowed it, but we still have full strength because we have done no resection. Nice triangular tip with a nice taper.